famous Hindi music director Bappi Lahiri. They have announced in hospital that he has been died of obstructive sleep apnea, and many medias are publishing the news that he has been died because of obstructive sleep apnea (OSA). We know he's a very famous Hindi composer and a lot of Bengali musics he had given. Okay, so being an pulmonologist, I want to really break some of the important background behind this obstructive sleep apnea. OSA, do you think it will directly kill a person? So first of all, what is OSA? And then you will get an answer whether it will directly kill a person. Obstructive sleep apnea means there is an obstruction in the upper respiratory tract, starting from your nose and mouth till the throat. There is some obstruction in the passage. Main important reason is obesity. When you are having a very high weight or you're having a big tonsils, a big tongue, all these can congest this airway. And when this airway is getting shrunken, the air is getting difficult to pass through this airway. So when the air is having a difficult to pass, that all shakes. When it shakes, then the severe snoring happen. So karata marte hain. So snoring is the main symptom of these patients. So the amount of air entering the lungs will decrease. So as a result, the oxygen entering the lungs will decrease. As a result, the blood in the oxygen will decrease. As a result, the brain oxygen going to the brain decreases. So the patient will feel so much of tiredness, sleepiness, and always drowsy, this kind of feeling. So this is obstructive sleep apnea. So will Bappi Lahiri sir just die of OSA? Not at all. He has not died of OSA, but he has died of complications which have arisen secondary to OSA. That means, what do you think the complications? When the oxygen goes for a loss, very low and very low oxygen, then there will be stress to the heart. Many of the OSA patients develop sudden heart attacks. Many of the OSA patients develop something called as cardiac arrhythmias, where your heart rate becomes like this, and then they atrial fibrillations or MAT, and then they die. Many of the OSA patients has got very poor uncontrolled diabetes or very high BPs, and these high BPs may trigger a stroke or again a heart attack. So his death would not be directly because of OSA. That is what I want to say. His death would be secondary to OSA attacks, like an MI or an cardiac arrhythmia or an severe massive brain hemorrhage or stroke. So this is the important thing. So what I have to do to prevent this OSA? Please maintain your weight. As long as you slim and as long as you are not putting too high obesity, this OSA can be prevented. That is the very most important thing. And other queries and other things what to do, please consult your pulmonologist. He will be the best person to guide you. Thank you.